Welcome to our last chapter, Chapter 21. I'll be reviewing the Incident Management System or Incident Command System. Some of the competencies that you need to acquire for EMS operations, knowledge and operational roles and responsibilities to ensure your own safety, your patient safety, and other personnel safety. Establish and work with Incident Command or Incident Management System or commanders. Mass casualty incidents due to terrorism and disaster. Understand the risks and the responsibilities of operating on scene of a natural or man-made disaster. Also, triage principles and resource management and resource allocation as well. And then we're going to go over hazardous materials awareness, risks and responsibilities of operating in a cold zone at a hazardous material operation, and we'll talk a little bit about the warm and the hot zones as well. So as an EMR, you should be able to identify the signs of a hazardous material incident and prevent injury to yourself and to others in the first minutes after arriving on scene, or even just prior to arriving on scene. It is important for you to understand the purpose of incident management or the incident management system, and the framework of the National Incident Management System, better known as NIMS, and then also understand basic triage principles. You should also increase your awareness of possibilities of terrorism. Hazardous materials are substances that are toxic, poisonous, radioactive, flammable, or explosive, and can cause injury or death with exposure to these substances or materials. During a hazardous material incident, your top priority is to protect yourself and bystanders from exposure or contamination. Identifying substances involved. The federal law, and there's a federal law that requires all vehicles containing certain quantities of hazardous material to display a hazardous materials placard. As you see here on the left side of your screen, there's various examples of hazardous material placards. The placard should involve a 4-digit identification number, which can be used to identify a substance and to obtain emergency information. Here is a picture of your Emergency Response Guidebook, or your ERG, the 2020 edition. This has the most common hazardous materials, their 4-digit identification numbers, proper emergency actions to control the scene, when these materials are present, or in instances when there's an incident involving these materials, and then emergency care of patients who become ill or injured after exposure to these substances. Other information that's included in this guide is evacuation zones, exclusion zones, and other things of that nature. So unless you have received training in handling hazardous materials, don't handle them. Keep away from the contained area or the containment zone or exclusion zone, or better, also in this slide is known as the hot zone. As soon as you recognize that this is a hazardous material incident, notify the dispatch so that other responders will be aware. Take note of your wind direction. Is there a fire involved? Things of that nature. Try to identify victims who have sustained acute injury as a result of the exposure. Remove them from the contaminated area, or have them remove themselves if they're capable of doing so. And then have trained personnel decontaminate them. We don't want to contaminate ourselves, especially if we don't have the proper PPE on. Give necessary emergency care, life-supporting care, and transport them to the hospital. Very few specific antidotes or treatments exist for most hazmat injuries. Emergency treatment usually consists of supportive care. Constantly reevaluate the patient's vital signs, including breathing status, circulation, and hemorrhage control. EMRs should receive specific additional training in hazardous waste operations and emergency response to emergency medical response level. Mass casualty incidents or multiple casualty incidents, also known as multi-casualty incidents, are situations involving more than one sick or injured individual, or anything that exceeds your available resources. These situations may range from a series of automobile accidents to a building explosion or even a toxic gas. You must first be able to recognize the situation as a mass casualty incident. These incidents require a very different method of operation from other emergency medical calls. Variables in mass casualty incidences include severity of a crash, access routes, available resources, response times, levels of emergency training, overall experience of EMS system. Your goals should be to provide the greatest medical benefit for the greatest number of people and to match the patient's medical needs with the appropriate treatment and transportation. As you're on the way to the scene, prepare yourself mentally for what you may find. Think ahead, plan ahead. Ask yourself the following questions. Where will additional help come from? How far away? What type? And how long will it take for them to arrive? When you arrive on scene, first focus on staying calm. Make a visual assessment of the entire incident on scene, number of potential patients, severity of their injuries, how much and what kind of help you will need. And also, is it safe to get out of your vehicle? If you see a hazy cloud around with multiple unconscious patients, you're probably way too close and need to get out of there first. Your initial radio report, creating a verbal image. So you're trying to paint a picture for other responding units. You want to use clear language, be concise, be calm and steady. Do not shout into the microphone. Key points to communicate include location of the incident, type of incident, any hazards, appropriate or approximate number of patients, and the type of assistance required. Basically, you are trying to literally describe what you see in front of you. Be as specific with your requests as possible. A good rule of thumb is request 1 ambulance for every 5 patients. Follow protocols of your department when calling for additional resources, however. Determine the parameters for emergency vehicles only and exclude all other vehicles from that area. Establish a one-way route for emergency vehicle traffic to approach the scene and a separate one-way route for them to exit the scene. Allow for adequate room for emergency vehicles that need to be close to the scene, and keep vehicles and personnel who are not needed at the scene at a staging area nearby, preferably upwind from the incident. Keep in mind that winds also do change, so always keep that in the back of your head that you may have to relocate your staging area or your access or your egress routes. Casualty sorting is creating an order out of chaos. Triage is sorting of patients into groups according to their need for treatment. The purpose of casualty sorting is to determine the order in which patients should be treated so that the most good can be done to the most or for the most people. The casualty sorting system should be simple and fast, based on skills and knowledge that you already possess. Do not worry about diagnosing patients. Categorizing quickly is a basis for a system of rapid life-saving actions. Do not stop during this assessment except to correct airway or severe bleeding problems quickly. This is essentially someone who is alive but is going to die within the next 60 to 90 seconds. Immediate life threats. Many EMS systems rely on simple triage or rapid triage treatment, or simple triage and rapid treatment, known as the START triage system. That's pretty much the standard go-to for Western North Carolina. It is simple and easy to remember and implement. START lets EMRs triage each patient in 60 seconds or less on following 3 primary observations. That's breathing, circulation, and mental status. START triage system is designed to help rescuers find the most seriously injured patient or patients, telling others what you have. The red flagging tape is used for your priority 1 or level 1 triage patients who have the most life-threatening injuries or illnesses. Level 2 or priority 2 is urgent need. They can delay up to potentially about 1 hour. And then priority 3 is your delayed care or your walking wounded, your green tags. And then, of course, you have priority 4, which is black, and this is dead on scene or prior to arrival. Keep in mind that all of these priorities can change. You can have a red become a black or a red become a yellow. You can have a green turn into a red and all vice versa. So it's very important to continuously reassess all of your triage patients. Your greens, when you move them into your green zone, you kind of corral them in one area. You can have simply one person kind of observing them and watching, kind of doing a windshield survey of that grouping of triage patients. And if they see someone kind of looking like they're starting to deteriorate, they can go and reassess them and reclassify them if need be. Once every patient has been triaged or you have enough resources arrive, it's always a good idea to go back and check all of your black tags. Your black tags, there are stories and instances where they have actually been alive, but in the urgency of the situation, they were tagged as a black, and later on were found that they could have actually been a red or even a yellow. So go back, re-triage even all of your black tags, re-triage your yellows and your greens, and whatever reds may still be on scene. Mistriaging individuals initially is don't get hung up on that. The goal here is to triage everybody as quickly as possible. So if you triage a yellow as a red and they get transported, that's not that big of a deal. They're already at definitive care, but what we don't want to do is triage a red as a yellow and delay that care that they actually need immediate life-saving intervention. So constantly reevaluate your patients once you've covered your entire triage process. So the first step, get up and walk. Tell all the people who can hear you to get up if they can and walk and move to a specific area. You're going to corral them over here underneath this street light, or we're going to stand over here by this bus or this building, that type of thing. If they can get up and walk, they rarely have life-threatening injuries, keeping in mind that things could evolve. To make the situation more manageable, ask those people who can walk to move from the immediate rescue scene to that designated area and stay there. Assign someone to monitor them and watch them to make sure that they do stay there, for one, and also to monitor their conditions for any kind of deterioration. Second step, move in an orderly, systematic manner through the remaining patients. Stop at each patient, providing a quick assessment and tagging. Your stop or your assessment should never take more than 1 minute. It should be about 30 seconds to 1 minute, or 30 to 60 seconds. Find and tag your priority 1 patients, those running or requiring immediate intervention. Examine these patients, correct life-threatening airway and breathing problems, and tag the patients with a red tag and move on. If you come up to someone who's questionable, you can try opening their airway and maybe give a rescue breath or two and see if that helps, but don't delay any more than 60 seconds. So how do we evaluate patients using breathing, circulation, and mental status? The START triage system is based on 3 observations. You have your breathing. Is it present? Is it adequate? Circulation. Is there a pulse? And mental status. Are they alert and oriented? Are they confused? Are they unconscious or unresponsive? So let's look at breathing first. Patients with breathing rates greater than 30 breaths per minute are tagged as a priority 1 or an immediate red tag. If the patient is breathing at a rate less than 30 breaths per minute, move on to circulation. and mental status. If the patient is not breathing, clear the mouth of any foreign matter, open the airway, position the head and maintain the airway. If the patient breathes, tag them as a red or a priority 1. A patient who needs help maintaining an airway is a priority 1 and receives a red tag. If you are in doubt as to the patient's ability to breathe, tag them as a priority 1. If you have if it's in question, they get a red tag. If the patient is not breathing or does not start breathing with simple airway maneuvers, tag them as a 4 or a black tag and move on. Come back to them later and reassess, but don't get tunnel vision, don't get hung up on that one patient. The best method for checking for circulation is the patient's carotid pulse. If the carotid pulse is weak or irregular, tag the patient as a level 1 with red tape. If the carotid pulse is strong, or if a radial pulse is present, move on to the mental status observation. Treat patients with weak carotid pulses for shock. You can elevate their legs to help return as much blood as possible to their core, to their brain, lungs, and heart. Get to assist with bleeding control, or ask one of the walking wounded to help you with that. If the carotid pulse is absent, tag the patient as a priority 4 or a deceased with black tape. The mental status, ask them to open your eyes. Determine whether the patient responds to verbal stimuli. Patients who can follow simple commands, have adequate breathing and adequate circulation are tagged as a priority 2 or delayed. Tag unresponsive patients who are breathing with a pulse as an immediate or a red tag. So START triage system is designed to help rescuers find the most seriously injured patients first. As more rescuers arrive, patients will be re-triaged for further evaluation, treatment, stabilization, and transport. Each mass casualty scene should have a person designated as a triage officer. Injured patients do not always remain in the same condition, so remember to go back and reevaluate and reassess your patients, or have somebody else do it. Process of shock may continue if untreated, and sometimes will continue if treated. Some conditions will become more serious as time goes on. If possible, go back and recheck the condition of all of your priority 2 and priority 3 patients. Working at a mass casualty incident. If you are not the first person to arrive on scene of a mass casualty incident, report to incident command or to staging as directed before going to work. The incident commander will assign you to an area where your help and skills can be best used. An effective incident command system depends on integrated, agreed upon protocols and procedures involving fire department, law enforcement, and EMS personnel. If you are the first on scene, you will have to make an initial scene size up, clearly and accurately report the situation to a dispatcher, and conduct your initial START triage. As more highly trained rescue and emergency personnel arrive on scene, accurately report your findings to the person in charge by noting the following information. Your appropriate or approximate number of patients who have been triaged into each of the 4 levels, and additional assistance requested, or what you think you may need additionally, and other important information. The National Incident Management System, also known as NIMS, was developed by the U.S. Department of Homeland Security to provide a consistent and unified approach to handling emergency incidents. NIMS is designed to effectively and efficiently handle immediate response, mitigation, and long-term recovery of small and massive natural and man-made incidents. NIMS expands on the incident command system in your department. There are 5 major areas addressed within the scope of NIMS. You have preparedness, communications and information management, resource management, command and management, ongoing management and maintenance. And then the ICS consists of 6 major features. These are standardization, command, planning or organizational structure, facilities and resources, communications, information management, and professionalism. And the EMR's role falls within the command and management component of NIMS. The federal government requires many agencies to utilize NIMS. It is recommended that EMRs be certified in ICS 100, which is an introduction to ICS, and then FEMA IS 700, which is a NIMS introduction. Additional information on NIMS is available at the Federal Emergency Management Agency's website, or FEMA. Most departments have other requirements. In addition, you may have the ICS 200 and 800 may be required by your agency as well, and then other NIMS classes in addition to that. Terrorism is a systematic use of violence by a group to intimidate a population or a government to achieve a goal. Terrorist acts may be instigated by a country's citizen or by people from other countries. Terrorists might use a wide variety of methods to incite terror, including use of guns, explosives, fires, chemicals, viruses, bacteria, and radiation. Agents used by terrorists are many of the same agents that produce hazards for emergency medical responders in everyday incidents and emergencies. Weapons of mass destruction. Any agent designed to bring about mass death, casualties, or massive destruction to property or infrastructure. This includes explosive, chemical, biological, and nuclear weapons. Preferred weapons of mass destruction to date have been explosive devices, trucks or car bombs, and then pedestrian suicide bombers. Many previous terrorist attempts used either chemical or biological weapons to their full capacity and have been unsuccessful. To understand the threat that terrorists pose to people and places, consider the places that terrorists might identify as targets. We have bridges, tunnels, pipelines, and harbors. These can constitute infrastructure targets. National monuments or even regional monuments are symbolic targets. Housing developments, automobile dealerships, manufacturing, those constitute infrastructure targets. Computer network and data systems might be targets for cyber terrorists. Farms, agricultural installations may be targets for terrorists trying to destroy or taint national food sources. Schools, government buildings, churches, and shopping centers represent high visibility targets. In an open society, a person committed to performing an act of terrorist or a terrorist act can access most components of infrastructure. Emergency medical responders should always be alert for hazards, those associated with the terrorist event, as well as those connected to any other emergency. Although you should be prepared for terrorist events, most of your emergency medical calls will not be for these events. In fact, you may go your entire career and never respond to a single terrorist event. A wide variety of agents and devices can be used to incite terror. These include explosive devices, incendiary devices, chemical agents, biological agents, and radioactive agents. Explosive and incendiary devices produce a concussion that destroys property and inflicts injury and death. Incendiary devices are designed to start fires. An explosive device can be hand carried or transported in a heavy truck. And often the first indication that an explosive or an incendiary device is present is the explosion or the fire that results from that device. Weapons of mass destruction safety considerations. If you are called to respond to an explosion, be alert for the safety hazards that might be involved or might be created by the explosion or by a terrorist. Do not enter an area that may be unsafe until properly trained personnel assess the situation or the risks and deem that area safe. Be alert for the possibility of a second explosion or even a tertiary explosion that is timed to explode when rescuers are on scene. Use the same safety skills you developed For other types of emergency situations, use your windshield survey or your scene size up. Add a weapons of mass destruction to scene. You will not be able to enter where the event has occurred, nor do you want to. Staging should occur upwind and uphill from the incident. Industrial process chemicals can be used to intentionally inflict harm on people. Many of the chemical agents that could be used by terrorists are the same chemicals that create hazmat incidences when accidentally released. Pulmonary agents are gases that cause immediate distress and injury to the pulmonary system. Their primary route of entry into the body is through the airway and into the lungs. Once these chemicals are inhaled, they damage the lung tissue, which leads to pulmonary edema and swelling. Pulmonary agents cause an intense coughing, gasping, and shortness of breath and difficulty breathing. Phosphogen gas is produced by burning freon, which is found in most air conditioning units. Symptoms of phosphogen exposure may be delayed for several hours after inhalation of the gas. Safety precautions for accidental release are the same precautions for intentional release by terrorists. Keep a safe distance away until properly trained hazmat personnel can handle the situation. Metabolic agents affect the body's ability to use oxygen at a cellular level. The most common metabolic agents are cyanides. Cyanides are produced in large quantities and used in gold and silver mining, photography, and creation of plastics. Cyanide is also produced by the combustion of plastic and textiles, so there is a potential for cyanide poisoning in any house fire. Contact with cyanide produces a shortness of breath, flushed skin, rapid heartbeat, seizures, coma, and cardiac arrest. The safety precautions for cyanide poisoning or exposures are that of the same precautions for intentional release by terrorists. You want to keep a safe distance and allow properly trained hazmat personnel to handle the situation. Insecticides are a class of poisonous chemicals that are inhaled or absorbed through the skin. Many insecticides are organophosphates. Absorption of organophosphates produce salivation, sweating, lacrimation, urination, diarrhea, gastric upset, and emesis, known as sludge. Far more emergency responders have experienced accidental contact with insecticides in routine calls than during a terrorist event. In an incident involving an insecticide, keep your bystanders far away to prevent any additional contact with the chemical. In an emergency involving mass people with sludge-like symptoms, assume you are dealing with an insecticide poisoning and call for help from a trained hazmat team. Do not make contact with the contaminated patients until they have been properly decontaminated by trained personnel. Nerve agents are among the most deadly chemicals developed. These chemicals can kill large numbers of people with relatively small quantities and can cause cardiac arrest within minutes or even seconds of exposure. Nerve agents block an essential enzyme in the nervous system and cause sludge-like symptoms. Four of the most commonly mentioned nerve agents are sarin, soman, tabun, and V agent. In an emergency situation, your primary responsibility is to keep yourself, other responders, and bystanders from becoming contaminated. A well-trained hazmat team and special protective equipment is needed to remove and decontaminate persons who have been exposed to these agents. A duodote kit contains drugs that counteract the effect of nerve agents. When a blister agent comes in contact with the skin, they produce burn-like blisters. Inhalation of these vapors cause severe burns to the respiratory system, and blister agents produce pain, skin irritation, eye irritation, and severe shortness of breath and severe coughing. Blister agents can include sulfur, mustard, and lewisite. Only well-trained and properly equipped rescuers with self-contained breathing apparatuses or SCBAs should approach the scene that might contain these agents. If you have a suspicion that it's there, that's what needs to happen. Once you go in and you become contaminated, it's too late. Safety considerations when dealing with chemical agents. If multiple people are experiencing unexplained symptoms, you should suspect a common agent at cause. Your primary goal is to recognize that that's a problem and that it exists, and to avoid contaminating yourself or other rescuers and bystanders. Stay upwind from a potential source or any potential source. Call for additional aid from a properly trained hazmat team. This chart down here on your screen explains or describes the various characteristics of the major type of agents, chemical agents. I'll give you just a moment to review or look over that. And this is also in your textbook as well. So biological agents are naturally occurring substances that produce diseases. They may be bacteria such as anthrax or plague, or viruses such as smallpox or hemorrhagic fever. Although biological agents are hard to disperse so as to contaminate large numbers of people, they could be used as a deadly weapon by terrorists. These diseases have an incubation period, which is a time frame from exposure to the disease organism to the time the person begins to show signs and symptoms of the disease. If people were exposed to an infectious organism today, it might be several days before they would show signs and symptoms of this. The first awareness of biological terrorist incident would likely come from a hospital emergency department or a public health department. Be alert for unusual patterns of disease with flu-like symptoms. Review current information about disease trends provided by your medical director and public health department. Practice appropriate standard precautions and PPE. If indications suggest a biological agent is involved in an incident, call for specially trained assistance and wait in a safe location. Patients who have come into direct contact with the agent need to be decontaminated before EMS contact or treatment is initiated. Even after that decontamination process, PPE still needs to be, the appropriate PPE still needs to be used. So radiologic agents, ionizing radiation is a kind of energy that is formed by decay of a naturally occurring or human-made radioactive source. Radiation is used in hospitals, research facilities, and nuclear power plants, and for military weapons. Exposure to excessive amounts can cause delayed illness, such as cancer. Exposure to large amounts can cause people to become violently ill within a few hours and may produce death within hours or even days. Radiation cannot be seen, felt, or detected with any normal body senses. Special instruments are needed to detect and measure the amount of radiation that is present. An explosive device containing a small amount of radioactive material is known as a dirty bomb. Such an explosion could contaminate anyone in the vicinity of the blast. If presence of radiation is suspected, stay away from the blast site until specially trained teams check for the presence of radiation with special monitoring devices. One of those devices down here that you can see on the bottom right of your screen is a personal dosimeter. This would be carried by a technician that measures the amount of radiation that's in that area. And then we have some of the signs and symptoms of acute radiation sicknesses here in the center bottom of your screen. Emergency response personnel need to develop an all-hazards approach for managing terrorist-related emergencies. In all emergencies, the same safety rules apply. Good scene safety, diligent use of standard precautions, be prepared to know your limits of your training, Many types of terrorist events require you to stay a certain distance away to avoid contaminating additional people. Be alert for secondary devices placed by a terrorist that are set to detonate after emergency responders arrive on scene. Establish an incident command as soon as possible. Know your role within working within the ICS. Treat these incidents as a mass casualty situation. And establish good working relationships with appropriate local, state, and federal agencies. Always be alert for your safety, the safety of other rescuers, and the safety of your patients and bystanders. Okay, in summary of Chapter 21, during a hazardous materials incident, your top priority is to recognize that a hazard is present and to protect yourself and bystanders from exposure and contamination from hazardous materials. The START system is a simple triage system that you can use at mass casualty incidents. It sorts patients into 4 different groups so that the most serious patients are treated and transported first. NIMS is designed to provide a unified approach to emergency incidents of any size. The goal of terrorists is to intimidate a population or a government so as to achieve a goal. Terrorists may use many approaches to incite terror, including uses of explosives, fires, chemicals, viruses, bacteria, or radiation, or any combination of the above. Chemical agents are man-made substances that can have devastating effects on living organisms. You have pulmonary agents, metabolic agents, nerve agents, blistering agents, and insecticides. Biological agents are organisms that cause disease. Radioactive weapons can create a massive amount of destruction. They include radiologic dispersal devices, also known as dirty bombs. Emergency medical responders need to consider their safety, the safety of other rescuers, and the safety of bystanders when dealing with a terrorist-related event. Okay, moving on to some review. First question, the first step in START triage process involves, is it A, quickly determining who is the most injured, B, asking all people who can get up and walk to move to a specific location, C, opening the airway of an unconscious victim, or D, calling dispatch? It's going to be B, asking all people who are able to get up and walk to a specific area. That takes care of all of your green triage tags right there. And that's generally the largest proportion of your incident or your victims. Question number 2, which of the following patients would be tagged as a priority 1 or a red tag? A patient who cannot maintain an open airway. B, a patient with a strong carotid pulse. C, a patient who does not start breathing with airway maneuvers and does not have a pulse. Or D, a patient with a broken femur. That's going to be A, a patient who cannot maintain an open airway. Question number 3, the function of the National Incident Management System is it A, assist EMS providers in managing natural disasters, B, oversee operations of all EMS and fire agencies in the United States, C, provide a consistent and unified approach to handling emergency incidences, or D, educate city governments regarding foreign terrorist attacks? And the answer to that one's going to be C. Provide a consistent and unified approach to handling emergency incidences. All right, that's all I have for you for Chapter 21 in the Incident Management Systems. Go back and review Chapter 21 in your textbooks. Use your learning objectives as reference points for studying. And if you have any questions or comments, please feel free to email me or contact me via the group chat. Send me a direct message there. And thank you very much for tuning in and listening.